The role of the patient in quality and safety is considerably important. I think through the years we have tried to solve many of these quality and safety issues with a lot of the stakeholders at the table, but we haven't brought the last stakeholder to the table, and that's the patient or family members who could provide such great insight and see certain things that we haven't. So one of the things we've done at MedStar over the last 2 years is the first thing was we created a corporate quality and safety advisory council made up of patients and families from around the country. These are national leaders, national advocates for safety and quality, truly leaders working on federal policies and procedures, working to make care safer. We brought them together as an advisory board for us, and every quarter we meet, we spend a day and a half, and we really go through issues and challenges that we have at MedStar from a quality and safety standpoint. That's more challenging than what I talked about in creating a system council, because I knew who those people were. But they were instrumental in helping us not only set up a charter for each of our hospitals on what the Patient and Family Advisory Council for Quality and Safety work would involve, working with the C-suite to make sure that there was reporting structures of that council up to the C-suite and the boards of those hospitals. There was also the idea of how do you select the right community members to be on a committee. That's challenging because you want to get the right people who want to come and make their health care better. And I think historically a lot of people have felt you have to reach out to a patient or a family member who's had a bad experience and bring them into the organization. And we've said no, it needs to be much more expansive. And so as we've reached out to the community, we found there are many people within the community of that hospital who want to see that hospital deliver the highest quality, safest care possible, and they're willing to donate a couple hours each month to come in and sit with leadership and go after significant problems. One of our hospitals took on the role of the idea of delirium in the ICUs. It's an ongoing occurrence, and we try to figure out how to treat it more effectively. Patients who have been in extended cares in the ICU tend to develop what's called a psychosis or a little bit of delirium. And we've gotten better, but we haven't gotten perfect at that. One of those Patient and Family Advisory Council for Quality and Safety teams got together with the team that was focused in on delirium and came up with a model that was much better than we had originally thought. They said, how could the family be part of that conversation? How could the family help in reducing that delirium that some of the patients would experience by reminding them where they are, by reassuring them that they are okay because you're in an ICU for a couple days. You start forgetting why you're there and what you're there for. It's really an important aspect of care. They helped, and together they came up with a model that made our ICUs better in regards to that.